Hello, everyone, and welcome to our WaveHDC webinar series. I'd like to start by thanking everyone for joining us today and to thank the speakers and for the team that facilitated today's meeting. Today's webinar is hosted by WaveHDC and sponsored by Shadowbox and our special guest, Birdrock Laboratories. So as if the last few years hasn't been crazy enough, today, here we are diving into the subject of navigating the future uncertainty that laboratories are facing and riding the current economic tide. During this webinar, we're going to summarize some of the problems laboratories are facing today and discuss one solution to those problems and how you can position your lab for success in these uncertain times. We will discuss how Wave and Shadowbox have collaborated to bring a first-of-its-kind solution to the market, and then dive into a case study of our mutual client, Birdrock Laboratories, who helped us bring this capabilities to life. We will also provide an opportunity for Q&A at the end of the webinar. But before we get started, I'd like to introduce our speakers, starting with myself. My name is Dean Pollock, and I'm the Chief Revenue Officer and co-founder of Wave Healthcare Data Curation. Joining me today is Seth Maheu. Seth is the CEO and co-founder of Birdrock Laboratories, and Greg Stein, who is the CEO and co-founder of Shadowbox. Seth and his team at Birdrock have been a loyal Wave and Shadowbox customer since 2018, when they helped us bring this technology to life. Earlier this year, our teams got together to review the impact that the technology has had on Birdrock's business. We're excited to share these game-changing results with you today. To kick things off, I'd like to provide some background on today's speakers. So first is Seth Maheu. Seth's laboratory journey started early as an intern at Millennium Health, which most of us know, while still in college, joining Millennium's team immediately after graduation. He held various roles of increased responsibility at the laboratory, ultimately becoming a senior sales representative. Seth recognized the high value, high touch service support clinics and their patients needed, and was inspired to co-found Birdrock Laboratories with his colleague, Stefan Mackey. Also joining me is Greg Stein. Greg was an early investor and employee at Millennium. Initially hired to perform industry and analysis and corporate development strategy, he ultimately engaged in solving challenging problems across the entire enterprise at Millennium. In late 2016, he identified a new game-changing technology with the potential to dramatically advance interoperability in healthcare. After significant market research and analysis, in 2017, Greg and his talented team at Shadowbox released this advanced technology to the healthcare marketplace. So why are we talking about economic uncertainties after what we've all gone through over the last several years? Because in laboratory, the fun never ends. And well, we've got PAMA rearing its ugly head again. We've got an economic recession that we're facing. We've got the No Surprise Bill Act on the horizon. And we're never short of challenges in the laboratory and diagnostic provider space. Here to tell us how he is addressing these issues with this advanced technology is Seth Maheu. Seth?
Hey, thanks, Dean. I appreciate that. Yeah, we have been around for a couple of years now. It's been kind of an interesting experience. We started in a very, very, very small location in La Jolla, where it makes absolutely no sense to have a laboratory. At the time, we were doing under 100 specimens a month, the end of 2016, early 2017. And since then, we've grown. We're in over 30 states now. We have obviously moved to a new location. We've got a much larger facility. We're continuing to add different testing modalities and testing verticals. We've got urine toxicology, of course. We've got blood chemistry. We've got PCR for UTI, and we're continuing to look for other opportunities to expand and develop. But you know, we've had a lot of space in the clinical diagnostic industry. I've been in this industry for the better part of a decade at this point, and I've certainly seen just about everything, and I really appreciate you guys taking the time to set this time aside and to give me the opportunity to complain about things that are challenges for us in the industry. I think that this is some tech that's extremely relevant, not just for us, not just for clinical diagnostic laboratories, but for really any service provider. So I kind of touched on some of these items just now. We started as a toxicology laboratory. Everybody, I think, started as a toxicology laboratory at some point, and we have looked to continue to develop and add more modalities to better serve the customer base that we have, to be as much of a one-stop shop as one can be, while offering esoteric services. In the interest of being able to survive in a space that's dictated by PAMA, that's getting continually pushed down by payers, we've really done everything that we can to be as agile and as adaptable as possible so that we can stay ahead of the curve. And I think we've been pretty effective. Birdrock itself is a COLA accredited, CLIA licensed laboratory. We've passed our GAP proficiencies. You know, we're not operating out of a garage, not anymore. Not that we were, but it was close. But what I think is really challenging, and this will sort of transition into you know, the rest of our issues, is that there's very little to differentiate one lab from another at this point. Certainly the technology and the standards are fairly uniform across the board. We're not seeing huge advances in urine toxicology testing. We're not seeing huge advances in blood chemistry diagnostics. There are certainly things that are coming out, but the time at which a technology is unique to a specific lab is just getting shorter and shorter with the proliferation of technology. So what we're trying to do is stand out in a space that is really occupied by very high quality lab services, very high quality performance, reliable results. It certainly presents a challenge. So when Greg and I were talking about this call and structuring this, he wanted me to frame some of the issues that we're facing, and there are so many that we have in front of us, but I really wanted to narrow it down and to be as specific as possible. When it comes to the logistics of being a laboratory operation, I sort of bucket our challenges into 3 areas. We've got the challenge and cost associated with customer acquisition. We've got the challenge associated with the actual data and the orders that we do get from customers. And then we've got the challenges associated with agility and adaptability. So with regards to customer acquisition, first of all, the market is very, very competitive. And even if if you get the opportunity to win a customer, it can be a challenge to differentiate one lab from another. There are labs that there are practices, there are clients that are sort of set in their ways, or they have things that are structured a certain way and they really like the way that works. So just as part and parcel of the basic sales process, getting in and overcoming an existing relationship presents major challenges. Labs are really a commodity at this point, and the effort that it takes for one client to switch from one lab to another is virtually non-existent at this point. So that's a whole bucket of challenges. And then assuming that you do get in, you can establish yourself, you build a relationship, you can demonstrate significant difference, you can sell the services that you have. The actual data that you're getting from the practices is incomplete at best. So there are, as we discussed, tons of different laboratories. You're asking people that are working as part of their day-to-day hourly rate to use one rec form and then switch to another requisition form. There are small changes one to another. You've got to get that person to gather up all of the health insurance and demographic information related to that claim, send that in, and then you're hoping that the order that you received is filled out correctly and the insurance that you get is valid. But more often than not, that's not really the case. I mean, we never cease to be surprised by the ways in which rec forms can be filled out incorrectly and insurance can be left off the table. So you've got the acquisition challenge, you've got the actual data that you get from the lab as a challenge. And then lastly, there's the sales ops, the agility challenge, which is, we're largely stuck with paper in the laboratory space. So many people are resistant to doing things differently. We want to be able to digitize and to be adaptable, and we really need to find ways to do as much of that work on our own as possible, because there's relatively little willingness to take on new technologies, to take on new processes, and to interrupt the established process and protocol that a lot of clients have in their practice. So overall, I think Shadowbox has been a excellent response to those challenges.
So thanks, Seth, for sort of framing the problem. And I certainly have appreciated our longtime friendship and your willingness to work with me very early on to try and address the challenges you've described. Just a little bit about me background-wise. I came to Shadowbox through a fairly circuitous route. I actually started my career as a staffer on Capitol Hill, handling tax and trade and science and tech policy. And what really fascinated me in that role was the opportunity to see entrepreneurs like Seth and Dean and others bringing to market technologies to address massive problems. Legislation's great, but actually seeing something occur in real time with real people and real products and services was inspiring. And so I ended up working for a number of different startups, one of them being Millennium Health, which is where I met Seth, and where I very closely observed the whole range of challenges that the laboratory industry, and quite frankly, not just labs, but really any ancillary service provider that is trying to access information to perform services in the healthcare space from the electronic health records, EHRs, that are within their customers' clinics. And so we'll go on to the next slide. So what we talked about, or what we saw, is an opportunity to, lots of friction, lots of cost. And at Millennium, we spent so much money and so much time trying to do integrations with our customer clinics, because we had the resources to do so. We even built an ordering portal, so we called it Millennium Connect, and that was great because it gave sort of the Millennium look and feel and drive for helping clinicians order correctly through the process, but it didn't have current data. And so what I imagined was, wouldn't it be great if we could just have the electronic health record on one side and the ordering process on the other, and have a button that would move the data at the time of the order from the EHR patient chart into the ordering process. And so I found this technology, Shadowbox, and it seemed to solve that problem. And so what we found from the very beginning is that it isn't just the lab order itself and the acquisition of data in the EHR itself that is the end all and be all. What we found was that there are so many downstream processes within a laboratory that are required to be functional and efficient in order to enable the first pass payment on a claim submission. And so that started to develop into what we are calling our single pane of glass. What we found is that we were able to, we pulled information out of the chart, but the information in the chart wasn't always accurate. People switch jobs, they change insurance, the information entered into the chart may actually be inaccurate, or it may not be entered at all. Some practices would simply just put a copy of the insurance card as a scan into the chart. And so what we learned is that what we needed to be able to do is not just take the information that was in the chart, but we actually had to run that information across other third parties to validate and improve that information so that by the time it came to the lab, it was as good as it could possibly be. And so I met Dean and the good folks at Wave, and we talked about the opportunity with Seth to be able to, at the time of the order, take that information from the chart and then run an eligibility and or discovery against it to see if we could find out if that insurance was eligible. And if not, go find that insurance and improve it. And that's the case study that we'll talk about and the results that we'll talk about. But if you think about that concept more broadly, it's not just about ensuring accurate, clean, and complete claims at the time of order. There's so many other downstream activities in a lab that can be improved by doing it at the time of order. For example, if you could take the order, the CPT codes, and now you have current and correct information on the insurance because of Wave, and now you can run that against that particular patient's benefit plan to determine if a prior auth is required. You can initiate a prior auth at the time of order. You could take all of that information and run that against a lab's payer contract compendium to be able to determine what the potential price that patient might be required to pay for that service would be, helping fulfill the Surprise Billing Act. And you can take that information, because you have contact information in the chart for that patient. You can even send a link to the patient to enable a collection of a copay, deductible cash pay at the time of order. So if you think about how many different things occur after the order has been placed that you can actually bring to the time of order, that's the technology and the real power of what we're doing at Shadowbox. We're able to rapidly connect to an application like an EHR, extract data, and automatically implement downstream activities at the time of order. So it might be helpful for me to share with you just a little bit about what that might look like, just from a clinic perspective. So here is there's no PHI here, but what we had built for Birdrock Laboratories and our other customers is in essence, a white labeled browser. And so it's called the Birdrock app. It looks like a Birdrock app icon on the desktop of the clinic. They download, install, open, and it opens directly into the EHR that they use every single day. So on the left where it says EHR, that would be whatever EHR they have. It could be eClinicalWorks, Athena, Practice Fusion, Cario, so on. And they operate within that as they would every single day, with no changes to their existing workflow, no changes to any of the functionality of the underlying EHR, no changes to the security and compliance of the EHR, such as multi-factor authentication and other HIPAA and compliance safeguards. But when it comes time to ordering, they click the red easy button that says order lab test that's there, and it achieves what I initially described earlier as that function, which is you have the EHR on one side and you have the ordering process on the right. And so this screen simply shows sort of that action as it's going on. But what it can do is it moves the data directly into the ordering process. And in this instance, I'm showing a digital order form. It could be an online ordering portal or what have you. And accurately and completely and securely moves the data where it needs to go. And now the clinic, all they have to do is click, I want to order this test. I have to enter a barcode for the specimen device. Maybe there's ask at order entry questions or some of the more complex tests like family history on cancer tests, and they hit submit. And this is where that single pane of glass activity occurs in terms of the third-party providers and channel partners like Wave, because now we're taking that insurance information in the chart and we're running against Wave's database of insurance information. And this is the kind of thing that you would then see, and that is, for this particular Jane Doe patient, we found out that what it said that they had United Healthcare within the chart, but we've now learned that coverage is terminated. And instead, they're now using Blue Cross Blue Shield of Missouri, and this is the current information for that patient. We found out that they moved from Madison, Wisconsin to Verona, Wisconsin, and so on. And when there's missing information that isn't even incorrect, it's able to identify that information through its demographic searches and actually populate. So you might have a date of birth that's either incorrect or not there, or a phone number that's not there for contact. So this is the kind of information that we can present to the lab at the time of order. And it's also important just to understand that an order made through Shadowbox and and bounced off Wave at the time of order is great for all those orders through Shadowbox, but for those labs that have clinics that maybe are not on Shadowbox yet because they're in transition, there is a back-end management portal, and Dayton can talk more about the complete set of Wave services. But there's not only a back-end management portal for non-Shadowbox ordered orders, there's also the ability that Wave can do to do batch orders. And Birdrock has done really all three. They've done orders where they've done the verification at the time of order. They've done batch uploads to Wave to get results, and they've also done manual checks as well. And with that, so that's sort of the background of how it all looks and works from a clinic perspective and the kind of data we provide. But let me turn it back over to you, Dean, and you can share more about Wave.
Thank you, Greg. So Seth put the framework of the problem together for us. Greg talked about the technology to facilitate automated autonomous data correction and the ability to extract data from an EHR and other systems and correct inaccurate information, replace obsolete or missing information before it gets entered back into your native systems, whether it's a billing system, a list system, or a source of truth at your laboratory. But without accurate data, that's just really cool technology. And so what we provide and what we bring to the table as part of this operation is our database. Wave licenses verified government regulated patient data from over 15 unique data sources throughout the United States on patients. We make this data available for laboratories to correct the information that's entering their billing and laboratory environment. Information like demographic verification of patient information, insurance coverage, primary, secondary, tertiary, address information, credit data, employment data, and other information that laboratories need to secure their reimbursement. And we combine the technologies, our technology with the Shadowbox technology to help you reduce the staff required in having to manually make these corrections. So now that we've kind of framed things up, let's talk about the actual results that occurred. So at this point, I'm going to turn it back over to Seth, and he is going to tell us how this process works and how his laboratory financially benefited from the changes that they've made. Seth?
Yes, great, thank you. One thing I feel like I may not have touched on, I mentioned agility, I mentioned the value of agility, but I want to frame that in more pragmatic terms. Somebody said to me once when I first started in the laboratory industry, insurance payers don't make any money paying claims. And that has stuck with me 100%. Not a day goes by that I don't think about that very simple, very accurate observation. The best offense is a good defense. And what I really like about working with the joint effort of Shadowbox and Wave is it allows us to sort of preempt the challenges that we're going to be getting from payers before we get them. So when I say there's a component that is necessary for agility, what I mean is the ability to anticipate the challenges that are going to be presented by insurance payers in getting claims paid and adapt to those challenges. So I've always liked Greg's sort of method of when he was the director of corporate intelligence. He was always asking questions, and he was always very attentive to what was happening in the space, and he was always very observant. And I think that Shadowbox is really representative of what he's observed as challenges, and his partnership with Wave has really made for a very robust tool that we have launched and have been really successful with. I think when Shadowbox first got started, there was like 1 or 2 EHRs, and at this point, I think there's like over 18 EHRs, and the process for integration is smooth and fairly straightforward. So I want to get to the next slide, but I do want to frame, Shadowbox as really being an excellent resolution for the problem of agility. So we looked at some data. I think it was like all of 2021 and all the claims that came through Shadowbox in 2021, something like 45,000 claims. Yeah. And what we found is that our ROI is basically 20x. It's huge. We're reducing the Shadowbox component is significantly improving the order side and the actual requisition, tracking and test ordering and physician intent to order. And the Wave side is gathering and reconciling the insurance component, the essential pieces to getting a claim paid. And I think we've spent 50,000 on Shadowbox and Wave over that time, and we're able to capture just shy of $1 million in revenue that we wouldn't have otherwise. Part of the beauty of the combination is that it's not just getting things that we need in anticipation. It's not just streamlining the process, but it's also reducing the downstream costs. The amount of effort and energy that it would take for full-time employees to go and individually track down the insurance information on a per claim basis, it came out to like 3 FTEs a year that we were, I don't want to say able to eliminate. We didn't. We were just more behind. We're now substantially more caught up with our billing process, and the combination of Wave and Shadowbox has precluded the need to bring on more staff as we have grown and developed. We have been able to push more stuff through Shadowbox and Wave and mitigate some of the growth challenges. I don't see it on this. We do have it on this slide. So the thing that I think is really telling about the value of Shadowbox, every laboratory, every service provider has a dumping bucket of claims that come in and they've got some issues. And whether you call those claims missing billing information or something else, that's what it is. They're claims that you just can't do anything with. You can't get them out clean until you go through some discovery track down process. I looked at all of the MBI claims that we have at Birdrock, and only 7% of the entirety of that bucket were Shadowbox claims. And even of those 7%, they were almost entirely made up of claims that had issues with diagnostic codes, DX codes, which is really something that's outside of the control of any automated system anyway. And that to me is the single most valuable data point with regards to the entirety of the Shadowbox process. We're able to bill for and capture more of the revenue that we are already getting. We are, without doing really anything else in terms of our day-to-day process, we're getting much better data, much better results, much better insurance information. We're reducing our rejections and denials and timely filing issues, really just through the implementation of this process. We've reduced the number of accessioning team staff that we're required to have. We've reduced the NCRs in the laboratory side, the non-conformances where something is done incorrectly or the opportunity exists for an error to snake its way through the process and get to the end user, because we're basically absolving ourselves through the implementation of Shadowbox of manual data entry, of having any hand in the process. They dictate at the time of order, this is what I want, right? We're getting that message directly from the practice and it comes straight through the system. We don't have any say. There's no interpretation. There's no, is this a check mark? Is this not a check mark? We don't have to deal with any of that. They're making those very clear indications and we're just processing precisely what we get. In actually preparing for this webinar and in looking at some of these data, I've been very pleased with Shadowbox, and I was surprised by how effective Shadowbox and the Shadowbox Wave combination has been, so much so that we've had meetings about pushing new clients to be Shadowbox only and to really just move away from paper entirely. Now, granted, there are a lot of clients that are sort of Luddites, and I'm sure a lot of people on this call can appreciate the clients that they have that absolutely have to have paper and it has to be sent to a fax machine, and they just want to continue doing business like it's 1984. And that's fine, but it's not. It's 2022, and the value in agility is huge, and it is continually expanding. So our objective is to really push Shadowbox to all new accounts and move to really an entirely digital format. I think we can go on to the next slide. Thank you. So I like this one. We looked at, of the 45,000 or so claims that we processed through Shadowbox. We looked at a subset of 15,000 of those claims where the wave process happened at the time of order. Initially, only 32% of those claims passed eligibility. We were able to run discovery for insurance on the remaining 68%, and then half of those came back with a hit. So automating this process and really taking the burden of the discovery off of our team and putting it effectively as labor on the practice on the client side has had a huge impact on the quality of what we've gotten. Even if the practice sends good data, even if they have an EHR, even if they do their best to send demographics, we're still not confident that what they send us is up to date. And so using a combination of Wave and Shadowbox to verify what we're getting before it even hits the lab means that we don't have to bifurcate our process through the billing side. And we do, in my mind, effectively everything that we can to ensure clean claims with as little upfront labor as possible. Again, the end result being something like a 20x ROI. So, you know, I like Shadowbox. I sort of collectively refer to this process as Shadowbox. It's really Shadowbox and Wave. And I really view the two of those functions as a symbiotic relationship. There is no way that I would want to exist in the laboratory space without some form of digital technology available to sort of shepherd us into a digitized future. Okay.
Dean, you're muted.
Okay, there we go. I apologize about that. So now we're going to open it up to Q&A. And the first question, you just kind of answered it, and that's how has, and this is for Seth, how has Shadowbox changed the way you look at customer acquisition and maintenance?
That's a good question. Actually, I have more thoughts on this that I'd like to share. The customer acquisition process is a challenge. There's that entrenched laboratory, entrenched sales rep relationship thing that everyone on this webinar is absolutely going through and has experience with. What is valuable about Shadowbox in that capacity is we're able to effectively get our claws into an account. We make things so easy, so quickly, that we get really good customer retention, because once practices start using the Shadowbox process and they realize that they can effectively just order with a single button click and not have to go through a photorec form or, you know, pull down different things from different parts of the patient chart, that it doesn't make sense for them to switch to another laboratory that doesn't have that technology, because now they're willingly taking on more work and it doesn't make sense for them to do that. So the retention has been really good. When there's turnover at practices, as there always is, the training component is really straightforward. Typically, I'm very hesitant about trying to do any sort of IT support or remote training over the phone, because you just don't know the skill level of the operator and the end user. You don't know what browser they're on. You don't know if they even know how to open a CD drive. But, you know, at Birdrock, we try to be as centralized as possible. We have a single point of contact for practices to get trained and to get in services. And we have a single point of contact for the Shadowbox interfacing process and training process. It's so straightforward that we do that over the phone. If somebody new, yep, just call Birdrock. We walk them through. It takes 20 minutes basically to train a new user at the practice level. And I think it's, you know, under an hour, depending on if Shadowbox has a interface established for that particular EHR, takes under an hour to start a new practice. So gone are the days of, you know, waiting for weeks and weeks and weeks to pay $15,000 for an interface that's just not good. I mean, that's personally part of what I really like about Shadowbox, is that it's disruptive to these EHRs that are building into their revenue model exorbitant fees for laboratories because they know they can get away with it because they've got entrenched customers. This is a more uniform, neutral fit that's giving consistent results to the interface process across the board. So we don't have one interface that's really good because their developers actually care, and then another interface that's just hacked up, coming out looking like a notes doc or a WordPad doc. We're getting consistent performance from all of the interfaces and all the practices that utilize it across the board.
Great. And here's another question for you, Seth. How is Shadowbox received by the clinics, and how do you incorporate Shadowbox into your sales and clinic onboarding process?
It's really received well, which is a little surprising to me. I have no issues with tech, but because I spent so many years in the field, my surprise is not when technology goes over well. It's when it doesn't. And Shadowbox has been so consistently easy and straightforward, and the feedback from our customers have been so overwhelmingly positive that, as I mentioned, I really want to move to a place where we're not doing any sort of requisition forms at all. We're just doing everything digitally, and we're minimizing liability for ourselves, right? If there are insurance audits, if there's pushback, which are always things that we're getting from payers, we can point to a Shadowbox order and say, look, this came to us digitally. We had no hand in interpreting this. We had no hand in interpreting the order. That came straight from the practice. That's your record and documentation for intent to order. These are the orders that they created. We wouldn't have this if they hadn't done it themselves. So I like it. Our practices like it a lot. And I think they also appreciate the fact that they're not getting hit up for missing information and documentation and chart notes all the time, because we're getting so much of that information in advance of the claim. It's almost a prophylactic measure against insurance pushback.
Great. So Greg, now I've got a question for you, Greg. It says, how does Shadowbox work? And frankly, it seems too good to be true.
It's a great question, and I've received it a lot. In fact, when we first started the company and started pitching to investors and things, people who are tech savvy said, "What you're saying is impossible," and so we had to go out and prove that it was. And in fact, it's a brand new technology. It seems so simple when I show you the image on the screen, but there's a tremendous amount of complex innovation that goes on behind the scenes. It's so complex, we actually have an issued patent on the technology. But what Shadowbox does, sort of more in layman's terms, is just think of it as a really smart browser. It's just like Chrome or Safari, but it's purpose-built for HIPAA compliance and security. And when you open that browser up and then you log into your EHR inside the Shadowbox platform, that browser, again, white labeled for our customers. So to the clinic, it's the Birdrock ordering app. What it does is it enables the ability to reach into the underlying infrastructure of the electronic health record application. It doesn't change anything or displace anything. All the security exists, multi-factor authentication, everything else exists, but it identifies the fields that are inside that application, the EHR. So whether it's a first name field or a date field, so it's meaning it has text in it, or whether it's a document field, meaning that there's some file there, or an image field, Shadowbox can identify where that is. And then through the rest of the technology, the listeners and the other AI and ML and other things that we've built, we're able to extract that data at the time of that it's being requested by the clinician. And that's how it moves from the EHR within the platform to wherever it needs to go. And what I didn't mention earlier, but that is helpful in sort of understanding the single pane of glass, is that sort of the second part of our patent is the ability to have multiple applications open simultaneously and move data across them simultaneously. So in the background, there would be perhaps a wave, an eligibility discovery check as part of the process, but you could simultaneously open up, say, a government registry, or we actually offer PDMP checks, prescription data management checks that can run a search on a patient in that state database and pull up the report to help with clinicians in understanding whether or not their patient's doctor shopping. So in other words, Shadowbox not only accesses from the front end the underlying infrastructure, but can move data across multiple places simultaneously and securely.
I want to dovetail on that with another thing that Shadowbox does that I like, and I don't want you to get a big head about this, Greg, but as I mentioned, insurance companies, they don't make any money paying claims. They look for any opportunity to deny claims and to push back. And if there's any payers on this call, please stop doing that. It's very inconvenient. One thing that I really like that Shadowbox does is with a validated PIN, it will append a digital physician signature to the rec form. I've gone through audits and we have gotten pushback from payers where the payers have said, well, this isn't signed. Of course not. We went through this, we established this in 2008. Not every requisition form has to be signed. We need to be able to demonstrate physician intent to order, et cetera, et cetera. But precluding that question from coming up in the first place is a really valuable tool. And that has really helped. Now, it doesn't help when insurance payers push back and say, well, this signature is not legible, which is another real thing that I've heard from payers, but it is an excellent tool.
Thanks, Seth. So the next question, our laboratory attempts to use insurance discovery to accomplish some of these tasks. How is this different? I think we could all answer that question, but I'll take a stab at it. So insurance discovery vendors, what they do is it's a simple process of taking your patient and then sending an eligibility transaction to multiple payers, usually your top 5 payers, to see if any of those payers will respond with any form of coverage. And so they're really just sending back what the payer sends them, and they're matching up a patient's, they're sending a name and a date of birth and hope that they get coverage back. But it might not be your patient that they're sending back. There's similar names and people born on the same date. And so, it has a risk component to it. Data curation, and what we're doing for Birdrock and for Shadowbox, is a creation of a database of US patients that includes their insurance coverage, primary, secondary, tertiary, their addresses, their demographic information, and other information that helps you get paid. And it's government regulated. So the database is updated on a daily basis. There were 70 billion records updated last year. So it's a database versus fishing different insurances to see if you get lucky and find coverage. We've got time for a couple more quick questions, Seth. This is for you. How quickly can you get Shadowbox up and running at a client?
It depends. It depends on how good their internet connection is. No, usually, assuming that there's an EHR mapped, under an hour typically, which is a really big sales advantage, because on the sales side, you need to strike while the iron's hot. And if they being the potential client is interested and they're engaged enough in that process, having something that performs reliably and well is a huge value add to say, oh, I can do this in an hour, and then to do it in an hour that's gold. That's what you want on the sales side. So it's really quick. If the Shadowbox doesn't have the HR mapped, it takes me a week to waffle on whether or not I want to pay to have it mapped. So it's 50-50 Shadowbox problem, Birdrock problem.
Great, thanks, Seth. And we've got time for one last question. So how does Wave access so much more information than other services? And that's a two-parter, and our lab has EMR interfaces in place already. And how do we fix the data that isn't coming through the Shadowbox application, but from an existing EMR? Okay, I'll grab that one. The first one, how do we get this information? It's licensed data from federally regulated sources and put into a database for your access. The database is coming from clearinghouses, payers, and various different sources. It's kind of like Experian or Equifax or TransUnion. They're licensing credit data from the places where you get your credit, and then they put together a score on you, but they also have access to a lot of information. Although I hate to compare ourselves to a credit service, but we do the same thing with healthcare data. We're building a database so that as people need that information to be able to get reimbursed for their claims, we have that data and you can access it. The second piece is a really good question, and that is our lab has an EMR interface already. So for sessions that are not processed through Shadowbox, Wave can act as middleware or a filter between your existing, the EMR data that's coming in or interface and your LIMS system, billing system, or your database, and correct that information in the same way that we correct it as it comes in through Shadowbox. The advantage that we have with the Shadowbox is Shadowbox can get us all the information that we need exactly how we need it, and do it all in real time. But we do use our filter on the back end on some of the systems where they don't have access to Shadowbox on the front end. So I think that kind of puts us up against time. I'm sorry, there's a few questions that we weren't able to answer, but we'll reach out to those individuals and get you the answers to those questions in short order here. So I'd like to conclude the program today. I'd like to thank our speakers for sharing their time and their expertise. I'd like to thank the team that facilitated the webinar and gave us all this opportunity today. And I'd like to thank everybody who took time out of their schedule to participate. Please reach out if you have any questions or you need additional materials. Our support staff will be sending out follow-up materials and will be making themselves available to answer any kind of questions that you might have regarding the technologies or further follow-up. So once again, thank you, and we appreciate your time and effort today.
Thank you, Dean.
Thanks, Dean.